For femoral artery, you have to mark 2 points, point A and point B. Now you have to mark point A between anterior superior iliac spine and pubic symphysis, which is mid-inguinal point, and point B on the adductor tubercle. Now join the point A and point B by a line. Upper two-thirds of this line represents the femoral artery. Popliteal artery divide the back of thigh into upper one third, middle one third and lower one third. Now put a point A at the junction of middle and lower third of thigh about 2.5 cm medial to midline of back of the thigh, and put point B on the back of knee in the midline, and put point C in the midline on the back of upper part of the leg opposite to tibial tuberosity. You have to know that 3 points A, B and C. For dorsalis pedis artery, put a point A between two malleolus and point B at proximal end of first intermetatarsal space. It is a space, not a joint. Don't confuse here. Point A is between two malleolus, whereas point B is proximal end of intermetatarsal space. Now join point A and B, which represents dorsalis pedis artery. Surface marking of great saphenous vein in front of thigh. Put a point A 4 cm below and lateral to pubic tubercle. Draw a small circle around this point to mark saphenous opening. Put a point B little below the center of saphenous opening and point C on the adductor tubercle. Now join B and C, which represents the great saphenous vein. For the surface marking of great saphenous vein in leg, on the adductor tubercle, put a point A. On the medial border of tibia at the junction of its upper two-thirds and lower one-third, put a point B. On the anterior surface of medial malleolus, put a point C. On the dorsum of foot, at the medial end of dorsal venous arch, put a point D. The line joining these points represents great saphenous vein in leg. For sciatic nerve, first draw a vertical line between posterior superior iliac spine and ischial tuberosity. Now put a point A 2.5 cm lateral to the midpoint of this line, and point B is midway between ischial tuberosity and greater trochanter, and point C at the apex of popliteal fossa. Now join point A, B and C, which represents the